You're looking for relief from lichen sclerosis, but they want to do a biopsy. You hate the idea, you don't understand why. Just treat you and let's move on. Hi, I'm your local OBGYN. I love women, and let's talk about it. So here's the deal. Lichen sclerosis is a chronic itching condition of our vulvar girl parts where we can start to see significant changes that cause itching, thinning, irritation, so the whole gamut. And we know that steroids and estrogen can really be beneficial for the treatment overall. So why not just get it if it looks like that at first glance? Here is why it's important to consider your options. Your local OBGYN may recommend that you get a biopsy of the area. And the reason is that women who have lichen sclerosis have an increased risk of squamous cell cancer of their vulva. So, skin cancer down there. What does that mean? It means that the general population, compared to women with a history of biopsy proven lichen sclerosis, have a 16 times increased risk of developing squamous cell cancer. So it would put you on the radar for close monitoring. If there was any changes or concerns, you would want to know that too, because your risk means that you're going to monitor yourself differently as well. Okay, so the vaginal tissue is going through a change in our mid years. All right. I'm your local OBGYN. Let's talk about why. So, when the estrogen goes down, there's a bunch of changes that are specifically happening to the estrogenized or now de estrogenized vaginal tissue. Number one, the tissue gets thinner, it stretches less, okay? And what happens is all the stretching that you try to do, like with intercourse, can cause little micro cracks and discomfort, which then makes pain feel like burning and irritation. Your pee hole doesn't close as easily, and because it's not closing as efficiently, you can have an increase in the number of urinary tract infections, but also the whole change to the vaginal tissue biome or environment, as we call it, can increase the number of infections, more specifically in the BV variety, bacterial vaginosis. So the whole biome of the vagina changes. In addition to the outside skin area that grows hair, as the estrogen goes down, you can have increased itching of the vulva and actually diagnosable skin changes that need additional types of therapies so they don't feel like you want to scratch the whole thing off. So there is an entire environment shift in vulva and vaginal tissue as a result of decreasing estrogen levels. There's a variety of therapies. We'll work on a video to see what you think is best for you. Have you ever had a cyst or an abscess in your vaginal or vulvar area? Are they all the same? Do they all mean the same thing? Hi, I'm your local OBGYN. I love women and let's talk about it. People come in commonly saying that they have some sort of like a cyst or a bubble in their vulvar area. Everybody thinks it's a Bartholin cyst, and that's because that's the one that is probably the most talked about in general, but they're not necessarily all Bartholins. Bartholin cysts are usually located in like the 4 and 8 o'clock position of your girl parts. So they're not at the top, but they're kind of like in the middle. And when we look at them, I can usually see that they're most prominent where the skin changes go into skin to shiny pink tissue. All right. They can be infected. They cannot be infected. They can come, they can go. Some people need surgical excision and treatment. All right. But there's other glands that exist. There's something called the Skene's glands, which are higher up towards your pee hole area. They can also grow. They usually don't grow as big as a Bartholin's, but they can also get fluid fillings, or they can get infected as well, and also potentially need surgical treatment. And then a little bit further away from the lips on the outside, you can just get vulvar cysts and collections. And this can be a variety of things. This can be part of the skin, like an infected hair follicle, just an area that swells and just gets an old infection for some reason. You can also see swellings of lymph nodes in that area if there's something more concerning going on. So not all cysts are the same thing. They could mean different things, and a lot of them can be treated at your local OBGYN.